Hello everyone, welcome to my channel and today I will give you some idea about radioactive iodine in medicinal use. So basically the I-127, it is the known as the radioactive iodine, and the isotope medicinally important is I-131. So I-131 basically emits gamma radiation and beta particles, that is electrons. So gamma radiations penetrate bodily parts and it can be used to detect, it can be used as an detector because we can see the image by using a conductor, and beta particles actually are used to destroy the thyroid cells. It is basically useful in case of thyroid diseases, in case of hyperthyroidism mainly. Now what is happening here? The gamma rays got accumulated in the follicle, and and beta rays also penetrate and causing destruction of the follicular cells of thyroid gland. Now what is happening here is that first of all pycnosis starts, then starts necrosis, and in the final step fibrosis start, and the affected tissues got destroyed without affecting other healthy tissues. Therapeutic uses, it is therapeutically used in the concentration of 3 to 5 millicurie because it is a radioactive substance. Millicurie in case of hyperthyroidism produced by Graves' disease or toxic nodular goiter. However, in case of multinodular goiter, the dose is somewhat more than that of the hyperthyroidism caused by Graves' disease. Diagnostic test, in case of diagnostic test, it is used in quantities of microgram and which does not produce any ill effects to the body. Now there are certain advantages of using this radioactive iodine. First of all, there is no risk of any surgery or damage to the parathyroid gland or the pharyngeal nerves. Next advantage, next it can be given to the outpatient care without needing any special equipment or special treatment. And last one is when the treatment is successful, the permanent removal from the hyperthyroidism is achieved. Now there are certain disadvantages also. First of all, 10 to 15% patient treated for Graves' disease related hyperthyroidism, they develop hypothyroidism, and 50% of this patient need thyroxine therapy in their later life. Compare in case of toxic nodular goiter, however, the production of hypothyroidism after treatment is less common than that of the Graves' disease related hyperthyroidism treated patients. Next disadvantage is that the onset is slow, means it can the onset of this substance is really slow, and the effect starts occurring after 2 weeks only, and peak level reached after 3 months, and for that every 3-month interval the evaluation is necessary, and in sometimes one more course of 3 months may be required. Next is during pregnancy it also destroys the thyroid cells of the fetus, causing cretinism in the newborn, and if it is used in third trimester, other complications are seen. It is not used for young patients because in their case it causes hypothyroidism in the later life, and these individuals have to take medication, that means T4 therapy for hypothyroidism for the rest of their life. So it is recommended for patients above 25 years age and who are and to whom there is no chance of performing the surgery, like if they have congestive heart failure or any heart disease, etc. So these are the disadvantages. And one more use is it can be used in some type of thyroid cancers where which cancers in which the iodine got accumulated in the follicular cells, and these are used after thyroidectomy to those patients. But one thing is that prior stimulation with TSH is necessary. So this is a brief discussion regarding radioactive iodine in medicinal therapy in medicine, and here I am ending my today's video. See you in my next video, and if you guys like the videos, please subscribe the channel. Thanks.